Use of GHP in treating alcoholism and narcolepsy. Alcoholism. GHP has been investigated as a potential treatment for alcoholism due to its ability to suppress alcohol withdrawal symptoms and reduce alcohol craving. It acts as a GABA receptors against which help alleviate symptoms associated with alcohol withdrawal such as anxiety, restlessness, insomnia. GHP may be used in controlled monitor setting under medical supervision, typically during the detoxification phase of alcohol withdrawal. However, due to the potential for misuse and associated risks, other medication and treatment approaches are typically preferred for alcoholism management. Narcolepsy. GHB has also been explored for its effectiveness in managing narcolepsy, a neurological disorder characterized by excessive daytime sleepiness and sudden sleep attacks. GHB's sedative effects can help regulate sleep patterns and improve wakefulness in individuals with narcolepsy. Sodium oxybate, a prescription form of GHB, is approved for the treatment of cataplexy, a symptoms of narcolepsy in some countries. It is typically taken orally before bedtime to promote better nighttime sleep and reduce excessive daytime sleepiness. It is crucial to emphasize that the use of GHB for therapeutic purpose should only be considered under the guidance and supervision of a qualified healthcare professional. Certain medication or such using GHB obtained illicitly can be extremely dangerous and illegal. Additionally, alternative approved medication and therapy are generally recommended as a first-line treatment for alcoholism and narcolepsy. Effects of GHB. Effects. GHB is usually taken orally. It is dissolved as a light-colored powder that easily dissolves in liquid, or as a pure consumption of less than 1 gram of GHB. Act as a relaxant, causing a loss of muscle tone and reduce inhibition. Consumption of 1 to 2 grams, causing a strong feeling of relaxation and slows the heart rate and respiration. At this dosage level, GHB also interferes with blood circulation, motor coordination, and balance. In strong doses, 2 to 4 grams, pronounced interference with motor and speech control occurs. Some of the adverse effects associated with GHB: sedation and loss consciousness. GHB is a potential central nervous system depressant that can cause sedation, drowsiness, and loss of consciousness. This effect can be particularly dangerous when combined with alcohol and other sedative substances, as it can lead to profound suppression of respiratory system and potentially result in coma and death. Memory loss and disorientation. GHB can cause short-term memory loss, confusion, and disorientation. Users may experience difficulty recalling events that occur during GHB intoxication, which can lead to dangerous situations and poor decision making. Respiratory depression. GHB can suppress the respiratory system, leading to swallow or slowed breath in case of overdose, or when combined with other depressant substances, this effect can become severe and life-threatening. Nausea and vomiting. GHB use can cause nausea and vomiting, which can lead to dehydration and electrolyte imbalance, particularly if the individual is unable to keep fluids down. Seizures. Abrupt discontinuation or withdrawal from GHB can trigger seizures. Individuals who use GHB regularly should not abruptly stop using drugs, but should instead seek medical guidance on tapering off the substance. Dependence and addiction. GHB has high potential for dependence and addiction. Prolonged or frequent use can lead to the tolerance, meaning higher doses are needed to achieve the desired effects. This can contribute to cycle of escalating use and the risk of developing a substance using disorder. Overdose. GHB overdose is significant concern, particularly when substance is used recreationally or is higher than prescriptive dose. An overdose can result in respiratory depression, loss of consciousness, seizures, and even death. It is important to note that the difference between a desired dose and overdose can be small and difficult to gauge accurately. Legal status and regulation of GHB in various countries. The legal status and regulation of gamma hydroxybutyrate vary across different countries, depends upon their laws. United States, GHB is qualified as a Schedule 1 controlled substance. In United States, it is illegal to possess, manufacture, distribute, or sell GHB without proper authorization. The penalties for GHB-related offenses can sever. United Kingdom, GHB is qualified as Class C controlled substance. In United Kingdom, it is illegal to produce, supply, or process GHB without a prescription or a license. Penalties for GHB offenses can include imprisonment and fines. Canada, GHP is regulated as a Schedule 3 controlled substance in Canada. It is illegal to possess, produce, traffic, or import GHP without proper authorization. Penalties for GHP related offences can include imprisonment and fine. Australia. GHP is classified as a Schedule 9 substance in Australia, which means it is prohibited substance. It is illegal to manufacture, process, supply, or use GHP without appropriate authorization. The penalties for GHP offences can vary across different states and territories. In Germany, GHP is considered a controlled substance under Narcotics Act. It is illegal to possess, manufacture, distribute, or sell GHP without proper authorization. Violation of law can result in criminal penalties. Netherlands. GHP classified as list 1 substance in Netherlands, which means it is considered an illicit drug. It is illegal to produce, possess, or sell GHP without proper authorization. Penalties for GHP offense can include imprisonment, fines. These are just a few examples, and legal status of GHP can differ significantly from country to country. It's crucial to refer to specific laws and regulation of countries in question for accurate and up-to-date information. Current research on GHP for neurological disorders. Research on GHP for neurological disorders such as fibromyalgia and chronic fatigue syndrome. Fibromyalgia is a complex disorder characterized by chronic widespread pain, tenderness. A small number of studies have explored GHP as a potential treatment for fibromyalgia symptoms. These studies suggest that GHP may provide some benefit in improving pain, fatigue, and sleep quality in fibromyalgia patients. The etiology of fibromyalgia syndrome is not yet fully understood. Certain hypotheses suggest a potential role of gamma hydroxybutyrate in influencing endocrinological abnormalities in patients with fibromyalgia. Objective of fibromyalgia. The aim of study was to investigate whether low-dose GHP has a growth hormone-releasing substance, reduce pain intensity, and improve depressive mood, physical improvement, and sleep qualities in outpatients with fibromyalgia. Additionally, these adverse events are materials and methods. The pilot study was conducted in the outpatient clinic for pain at the Clinic for Anesthesiology and Surgical Intensive Care of Charities Universitas Medicine Berlin. In the study of 25 female patients with fibromyalgia, according to the critic of American College of Rheumatology, were randomized into two groups over 15 weeks. Patients of intervention groups received 25 mg versus kilogram body weight oral GHP before going to bed and were compared with the placebo control group. In addition, all patients participated in operant behavior. Pain treatment is in a group setting. Dependent variables were pain intensity, depressive mode, and physical impairment and quality of sleep. Results of this study: there was no group difference in the course of pain intensity p 0.61, depressive mode 0.61, physical impairment 0.25, and quality of sleep 0.44. However, all the symptoms improved across the group from pre-therapy to post-therapy. Low-dose GHP did not increase growth hormone, blood concentration. The number of adverse events that were reported more than 2 times was similar in both groups. Discussion. Administration of low-dose GHP did not yield clinical improvement in female outpatients with fibromyalgia. Generally, improvement in the course of treatment may have resulted from operant behavioral pain therapy. Future studies on GHP should control hypothetical risk factors for identification of non-response